Greater Buffalo United Accountable Care Organization, or GBUACO, is on the cutting edge of transforming our healthcare system from a sick care system, a system that waits until we become ill before it kicks into action, to a system focused on helping us stay healthy. GBUACO's blueprint for healthcare mixes health, wellness, and lifestyle into one blended marketplace. GBUACO's healthcare design can be broken down into 5 major hubs that are interconnected with the goal of improving the quality of patient care while lowering costs. GBUACO's hubs consist of smart hubs, precision medicine, retail health and wellness, personalized consumer markets, and personalized chronic care. These hubs include in-person models of care combined with virtual care techniques through telemedicine. All of these health hubs merge under one roof at a newly constructed state-of-the-art medical facility located on Buffalo's Lower West Side. The facility houses Urban Family Practice and the Greater Buffalo United Accountable Healthcare Network, or GBUAN, an organization that provides care coordination for Medicaid patients. Self-monitoring and reporting technology, or smart hubs, use technology to make healthcare easier to access, deliver, and understand. GBUACO has instituted an extensive framework of up-to-the-minute technology to make sure communication flows swiftly and easily throughout the organization, from company leadership to staff to our network of providers to our partners in the community. Health tips play on televisions in all waiting rooms. Patients are kept up to date on health trends and news about GBUACO, GBUAN, and community events. Staff members can control bottom-of-the-screen ticker information from any floor of the building. The ticker feature includes the latest information on what is happening in the GBUACO network. GBUACO's new state-of-the-art medical building includes IT rooms with servers on every floor to ensure top speed and top performance in the stream of information. GBUACO utilizes biometrics to ensure safety of those entering and exiting the facility. Urban Family Practice and GBUAN have installed member and patient registration kiosks, much like the self-check-in kiosks found at most airports. The devices streamline the check-in process, cutting patient waiting times and reducing long lines at the reception desk. As members and patients walk in for their appointments, they are prompted to sign in at the kiosk. They're asked to enter their names and other personal information and are automatically signed in for their appointments, with all of their data updated and entered directly into the MedEnt electronic medical record system. This results in fewer errors and higher levels of privacy. The time saved by utilizing the MedEnt kiosk system reduces frustration for staff and patients and leads to decreased costs and increased revenue. GBUACO has integrated Skype for Business as its major communication tool. All communication between employees takes place through Skype for Business. Patients, doctors, GBUAN staff, and GBUACO staff can be connected and heard immediately. Providing GBUACO patients with an opportunity to receive on-demand healthcare information at any time, day or night, is of crucial importance. GBUACO utilizes ICE, a 24-hour nurse advice phone-in line that gives patients counsel on when, where, and how to use the healthcare system appropriately. Specially trained registered nurses answer telephone calls from patients and provide healthcare advice utilizing clinical guidelines developed by physicians. The ICE Nurse call-in line provides referral information based on the caller's presenting symptoms. On an escalating scale based on the patient's symptoms, RNs provide general health information, self-care instructions, guidance on when to see a primary care physician, help with finding a doctor if the patient does not currently have one, help with finding an urgent care clinic within the GBUACO network, and lastly, help with arranging emergency services when necessary. Without the ICE call-in system, many patients will default to the only other service available 24/7, their local hospital emergency room, or worse, they'll do nothing at all. With this one service, GBUACO achieves multiple health management objectives. GBUACO partners with Lenovo Health and LifeMed ID to provide a high level of security for our electronic medical record system, or MEDENT, through Lenovo's fingerprint authentication software, or fingerprint reader. LifeMed also employs a facial recognition application and assigns patients with a quick response, or QR code, that can be read as an integrated tool on the GBUACO app. Precision medicine is redefining how we think about diseases and prevention. It's a personalized plan for healthcare that takes into account individual differences in people's genes, environments, and lifestyles to develop more effective targeted treatment for diseases like cancer and diabetes. Currently, most medical treatments are designed for the average patient, but one size doesn't fit all, and treatments that are very successful for some patients don't work for others. The precision medicine approach allows doctors to more accurately predict which treatment and prevention strategies for a particular disease will work with which groups of people. GBUACO works with Circuit Clinical to analyze data drawn from MEDENT, our electronic medical records, or EMR, system. The Circuit Clinical platform employs algorithms to clearly and accurately identify an at-risk population with the potential of going to the next stage of disease, or a healthy population at risk of developing disease, and intervenes by applying patient matching and inclusion-exclusion data. Circuit Clinical allows GBUACO to run reports on very specific demographics while still following patient privacy laws. That's because each patient is de-identified, meaning all personal identification is removed from the reports. In addition, this important service allows GBUACO to identify individuals that qualify for clinical studies and trials. For instance, through Circuit Clinical, GBUACO can produce a report of patients who are African American, age 50, who smoke. Then providers look at treatment outcomes for particular conditions for that exact population group. We determine how we're doing and what needs to be changed. GBUACO partners share clinical outcomes and incorporate successful clinical care options within the provider network. With Circuit Clinical reports, GBUACO also checks the efficacy of pharmaceuticals. Reports show which medicines are working well for some patients and which are not. GBUACO's pharmacy eliminates hassles for the consumer through its partnership with a network of physicians who integrate coaching and medication management into the primary care offering. The whole care team is kept up to speed. The personalized consumer market is a model that tailors medical care to individuals and enables patients to direct healthcare to their specific needs. Personalized healthcare utilizes genetic profiles to determine treatments and the risk of disease in individuals. It also provides patients with technical tools like digital health and fitness apps and telemedicine providers. These on-demand health solutions enable people to understand their health on their own terms while receiving doctor input. GBUACO addresses the personalized consumer market by providing wellness services. We provide health coaching, offering patients education, motivation, and support to help them achieve their health goals through lifestyle and behavior adjustments. An on-site dietitian advises clients on how healthy eating habits can prevent illness and help achieve and maintain optimum health. Personalized eating plans are developed to each patient's specific needs. Healthy cooking classes are offered. GBUACO has a gym for patients that features personal training, group exercise classes, and exercise machines. GBUACO's personalized chronic care hub helps people with chronic disease live better through proactive engagement and prevention. Biometric monitoring and real-time interactions utilizing care coordination and telemedicine are in play. Each patient with chronic care issues is assigned a Patient Health Navigator, or PHN, through GBUACO's partner, the Greater Buffalo United Accountable Healthcare Network. PHNs work with their chronic care patients to ensure that medical appointments are kept, transportation is provided to appointments, medical orders are followed, and that the patient carries out his or her wellness goals. The care coordination process means that patients are kept healthier with the goal of avoiding costly trips to the emergency room and inpatient hospital admissions. Because lack of transportation is a major issue for GBUACO patients, GBUACO is introducing G-Transport, a driving service for Medicaid recipients that offers convenient rides to medical appointments. G-Transport will be a major extension of the transportation system currently offered by GBUACO's partner, GBON. E-visits give patients more flexibility in accessing care. E-visits give patients more flexibility in accessing care. E-visits are initiated by the patient through the patient portal in MedEnt. From the comfort of their own homes, patients are able to select a symptom and a provider. Then an e-visit bill appears in the MedEnt chart. Next, the patient fills out a questionnaire regarding his or her symptoms, current medications, and allergies. The patient can even attach a photo if one is pertinent to his or her ailment. Next, the patient's case is triaged. If a prescription is required, the patient can select a pharmacy convenient to home. Progress notes are added to the patient's electronic medical records, and the doctor selects the diagnosis and current procedural terminology, or CPT code. Consumers of healthcare are a driving force behind a revolution in how healthcare is delivered. Services offered at GBUACO blend health, wellness, and lifestyle into a single philosophy. GBUACO's partners are accelerating the movement from inpatient to mobile health by utilizing new technology that also enables e-visits and biometric monitoring. As the leading provider of new patient-centered care services, GBUACO is energizing the healthcare evolution to ambulatory, home, and mobile settings, while embracing powerful new predictive and preventive technologies.